When a patient is having surgery, I think the questions for them to ask to their surgeon is about their experience in a particular technique, any risks and complications. And when the patients are signing the consent, there are two sets of complications which are mentioned in the consent form. One is the general set of complications which could occur with any laparoscopic operation. Even these should not be taken lightly, but this is a standard set, like bleeding, infection, damage to the surrounding structures, inability to proceed with surgery, conversion to an open operation, which of course involves a bigger cut on the tummy and longer recovery period, deep vein thrombosis or a pulmonary embolism when that clot migrates into the lung. And special measures are taken throughout surgery and afterwards to avoid all these complications. But the hernia-specific complications after a laparoscopic operation are recurrence, and the second complication will be chronic neuralgia, or it could be graft rejection. As far as recurrence is concerned, it should be less than 1%, which is less than 1 in 100. But in the hands of the experts, generally, this is the overall figure when you get a less than 1% recurrence. But in the hand of the experts, the recurrence rate is less than 1 in 1,000. So it's 0.1%, much less than any other repair or approach. Chronic neuralgia, the incidence is extremely low with laparoscopic hernias, though there were some incidents of chronic pain after hernia repair, but that was in the early 90s when the technique was still being defined and some of the stapling or the securing of the mesh was done in the area of the nerves, which gave chronic neuralgia in the legs. But with a keyhole approach, one does not even see or go near the nerves which supply the groin, the root of the penis, and the upper scrotum. So risk of chronic neuralgia or chronic numbness in those areas is negligible. And in my own experience, I haven't come across one patient with more than a few thousand of hernia operations that I've done. As far as graft rejection is concerned, I believe that this is a very rare incidence of this, and probably it's less than 1 in 2,000. But sometimes we do the operation, everything goes well, the patient is fine, but a year or two later, the graft may get rejected by the body. This incidence of graft rejection, this is not due to infection or any other issues. This happens after a long time, and this can occur with any hernia operation where graft is used. Graft is a must and highly recommended by all the associations and organizations in Europe and America, because without it, the incidence of the hernia recurrence is very high. Grafts are safe to use and have been used over decades. And overall, the quality of the graft and its manufacturing is excellent, and lots of work is being done into this to keep these grafts lightweight and to allow the tissue to go through the gaps in the graft so that it becomes incorporated into the body. And most of the time, the graft is unrecognizable if you went in to do another operation. You may feel that as if there is some structure there, but the body tissue covers it beautifully, and it's unrecognizable. The incidence is low, but of course, any surgeon with some experience should be able to deal with that effectively, but a person may need to be made aware of this. About hernia, I think it's really important to have it done right first time so that one does not get any problems, because groin is a very dynamic area with our walking, running, exercise, activity, eating, drinking, movement of our mouths and everything. This comes into action. And it's really important that we do not get any problems in this area to have a good quality of life after surgery.